All right, so did everyone get a handout? I'm going to try to figure out where to stand here. I think I can see most everybody right here. So everyone's got a handout on the health program. And I'm glad that Dr. Lemkuehler went first, because I'm telling you, by far and away, the most important thing is that they eat. A calf that eats will live most of the time. And then all that we do, vaccination-wise, will work if the calf's eating, and won't if they're not eating and drinking. So where we're going to start today, if you'll go to your handout, the back of the first page, down where it says risk classification of purchased calves. Because this is really where you want to start. You want to look at what you're buying or what calves that you're going to feed out. So we're going to look at the ones we bought for this program. You know, they're about 700 pounds on average. We've got a mixture of different breeds. We've got steers, we've got heifers. They came through a sale barn. Okay, so we kind of got a Duke's mixture. Looking at the category here, high risk exposed. When we say high risk, it means risk of disease, risk of development of pneumonia. All right, number one, weaned on the trailer. You think 700-pound calf was weaned on the trailer? More than likely not. Some are, but most of the time not. So if they're weaned on the trailer, you know, your lightweight calves, your 400-pounders, that's a really, really big risk factor for disease. So we're not dealing with that here. They've been through one or more auctions, yes. These have come through a sale barn, so they've got that risk factor. Commingled with many other calves from multiple farms, yes. These are probably all from different farms. They got that risk factor. Sick on arrival to the farm, none of these were. They were all healthy when they got here. Experienced a greater than 30-degree temperature fluctuation within a 24-hour period. We're not seeing that right now. You know, earlier in the spring and late in the fall, we'll get those huge swings of temperature. Wet or cold conditions are exceptionally hot. I would not consider either one of those at this current time. It's pretty hot, but we're at least getting nice breezes, and it gets cool at nighttime. They're not excessively shrunk. These didn't go a long distance. So we didn't have any long 10, 12-hour haul. Exposure within the prior 72-hour to animals showing signs of respiratory disease? Probably so. Usually if they've gone through a sale barn, they've been exposed. So they've got that risk factor. And the last one I have is if they're lightweight, under 500 pounds, which these are not. So when you look at these calves, they're not really high risk. They're not what I would consider to be right on the edge of getting sick. But these have the potential. They've been exposed. They've probably got the virus circulating. We don't really know too much about their history, but they're big. You know, they're big. They've got a little bit of age on them, and with age comes immunity. You know, that's just a consequence. Getting older, getting better nutrition, their immune system works better. So we start to look at this and say, can they handle vaccine? All right, on the very first page, calves on arrival. Let's go through that stepwise. Number one, allow the calves to rest, drink water, and eat hay before you work them. So when you get them home, you don't want to throw them right through the chute and work them. Give them a little bit of time. 8 hours, 10 hours, give them a chance to drink, give them a chance to eat, and rest. They're stressed out. I told the last group, if you stuck me on an airplane and shipped me across country, and I landed and I was tired and I was hungry and I was thirsty, and then you vaccinated me, I guarantee you I would not mount any immune response, because I need to rest. You got to settle down, rest a minute, eat something, grab another gear and go. And calves are the same way. Second step, identify with the tag. That's pretty self-explanatory. Number three, vaccinate with a viral respiratory vaccine. Really important, because when we see, let me go get my slides here. When we go through pneumonia outbreaks, and we get lots of them at the lab, where folks will get multiple death losses due to pneumonia in a group of calves. So we do the necropsy, and we run the tests on it. So this is really typical. We see this very frequently. There's 50 in this group. 20 of them are currently sick. 3 of them are already dead. They are 6-month-old steers. History, they're lethargic, coughing, runny nose, slobbering, head down, went off feed. this is an actual case, by the way, but they all look very, very similar. Their nutrition, they're on pasture, hay, grain, and creek water. They've been treated with Nuflor, Draxxin, and Baytril. You know, 3 of the strongest drugs we've got. They've probably spent $100 or better on medication. Their vaccination history, they were given shots 2 weeks ago at the sale, and then they were boosted at 5-way a couple of weeks later. So we did the necropsy. Of course, they've got a terrible pneumonia. Do the culture on the lungs, we get Martin-Gatton hemolytica. That's the bacteria that really causes pneumonia, the bad pneumonia. So remember with respiratory disease, I think this is a refresher for most, with pneumonia you got 3 factors in cattle. You're going to have a bacterial component, you're going to have a viral component, you're going to have a stress component. Those 3 things have got to be there. Your bacterial component is almost always Martin-Gatton hemolytica. It's like a forest fire. It comes in and it absolutely does damage fast to the lungs. So that's one we really have to be aware of, and we have to watch out for that. The problem with Martin-Gatton, especially when they come out of the sale barn, is when we run the susceptibilities on antibiotics. I mean, this is a column of all the different types of antibiotics. Look at the number that are resistant, 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 which means the antibiotic doesn't work. This one's susceptible. Well, that's a pig drug. We don't even use it in cattle. Ceftiofur is one that is always going to come up susceptible in the lab, but doesn't necessarily transfer to the farm. In other words, Exceed always looks like it works, but actually in the calf, we don't see that kind of success. So we've got a double problem. Not only do we have a bacteria that's very aggressive, destroying the lungs, but we've got a lot of antibiotics that don't work against it. So that's our bacterial component. Then we've got a situation where our trace minerals are very low in a lot of these calves. So, you know, we don't know their history. We don't know what was offered on the home farm. And a lot of the farms in Kentucky are still just using salt, or they're using red salt, you know, with just iron in it. So they're not getting good trace minerals, and this state is definitely deficient in selenium and copper, and there's no other way to get it if we don't give it to them, because it's actually in the ground. So if we don't have it in the soil and we don't offer it, they don't get it. Oftentimes, you can almost bet the farm on this one. When you run the trace element panel on the liver, on these pneumonia outbreaks, the copper level is going to be low and the selenium level is going to be very low. And a lot of times the selenium won't even make it onto the scale. So you can see from that previous slide, we used all the high-dollar antibiotics available. We used every vaccine available, and it did absolutely nothing because we didn't correct this on the front end. So we got a nutrition problem that needs to be addressed. The other component is, we got the bacteria, Martin-Gatton. The other component's usually a virus, one of the viruses that causes respiratory disease, and almost 99% of the time it's going to be BVD. BVD stands for bovine viral diarrhea, which confuses everyone because it doesn't cause diarrhea, it causes pneumonia. So, and that's going to come up positive on our test. So going back to our handout, number 3, vaccinate with a viral respiratory vaccine. We need to cover BVD. That's got to be in there. So if you switch to the back of your handout, I've got all kinds of drugs written down. That very top third is all your respiratory virus vaccines. You'll see on the left side, killed virus vaccines. Put a big X through it. You all don't need to use those. You don't need to use a killed virus vaccine. They take too long to work. By the time you've got 2 doses of a killed virus in there, you're looking at 3 weeks. 3 weeks before you get immunity. That's way past when you need it. What's peak time for respiratory disease in newly arrived calves? Who knows? I know you know, Brandon. What is it? Going to be right around a week to 2 weeks. Right in that 10 to 14 days is really peak time. So if you're not getting immunity till 3 weeks out, you're wasting your money. All right, so that puts us down in the other two categories, either the modified live virus vaccine or intranasal. Intranasals are beautiful things when you have very, very high-risk calves. You know, lightweight calves, high risk, they're just right there on the edge of getting sick. Intranasals are great because you squirt it up in the nose, gives them immediate immunity, doesn't really affect their system, doesn't cause a fever, doesn't make their neck sore because you're not injecting them, but they don't last very long. Intranasals will give you maybe a month. But I promise you, if I was buying 4-weight calves out of a sale barn right now, that's what I'd be using, is an intranasal, because it's just easy on the system. These are 700-pound calves. They can take an injection. They can take an injectable, so you're going to want to hang with these on the right side, the Pyramid 5 or Vista 5, Express, Bovishield. Those are all well-known vaccines. That's what you need to give on arrival for your viruses. Next step, number 4, vaccinate with a Mannheimia hemolytica toxoid. I told you already, Mannheimia is one of the bad ones. So down here, I guess it's about halfway down on the left, is a list of these. Presponse, HM, Presponse, SQ, one shot. Pulmigard. These things are well advertised too. If you look at any of the beef magazines, you'll see those. So they'll need a dose of this. Now for 700-pound calves, if you look just to the right of that, it has modified live virus vaccines plus a Mannheimia toxoid. That's a combination vaccine. If I was buying 700-pound calves, that's what I would use, is a combination. They're already got a lot of immunity. They've likely been exposed to a lot of things already. I like the combination vaccines in heavier calves. Lightweight calves, I'll use probably a different combination. And that's where it's really nice to have a vet working with you that can kind of work through your group of calves, because every group of calves is different that you buy. They're all going to have a different set of circumstances. So you can kind of tailor your receiving program. Number 5 on the list is deworm. You'll see I put in there, and I'm really strong on this, use a branded product, not generic. Don't use your generic ivermectins on these calves. There's a parasite known as Cuperia, can steal a lot of your gain away. It's usually in young calves, young cattle, I say, not necessarily baby calves, but in under a year. Cuperia is completely resistant to generic ivermectin. It will not touch it. So you need to use one of the branded products. Ivomec, Dectomax, Epronex, Cydectin, one of those will take care of that parasite. For these calves that we bought for this program, they are not going back out on grass. So once we deworm them, they're not going to get reinfected. So what we chose to do was use one of the oral dewormers, one of the drench dewormers. It's white, brand name Safeguard, Valbazin, Synanthic. Those are your 3 types. The nice part about white dewormers, they'll completely wipe out all the parasites, internal parasites. They do a great job. They'll kill everything in there. We don't use a lot of them because they're hard to give. You got to catch the head. You got to get them to swallow it. Most people don't want to take that time versus pouring on something on their back. You know, it's a big difference in time. However, the white dewormers are very effective. One thing to remember about white dewormers, they only work internally. So you need to still pour something on their back for lice and for flies. And that's a place where you can use your generic ivermectin. It's cheap, pour it on there, use it for fly control. Next thing I have on the list, optional practices, treating all calves with a long-acting antibiotic. Definitely not needed in this case. Big calves, not really too high risk. What we did instead, we put them on that stress ration. has CTC in it, that's chlortetracycline, right? Gave them an antibiotic just in the feed, and that took care of it. That controlled any respiratory disease problems. Next one, consider using injectable mineral preparation. You already saw that on this last slide. So many of them are already trace mineral deficient. There's a product called Multimin 90 that's injectable mineral. If you think that these calves, you got an unknown history, maybe they look, really rough coated, and you want to give them a dose of Multimin just to boost their mineral level up until they start eating well, it's not a bad idea. If I bought small calves, I would definitely use it. 700 pounders are probably okay. I always think of 700 pounders, they've already been on some feed. Next thing, testing for BVD-PI. Is anybody familiar with that? I know Brandon is, others are. Taking an ear notch. We're going to demonstrate that up here in these calves. Extremely important. Let's see here. I know the last group I kind of went over BVD. And most of this we've already talked about, the types of stress, risk classification, what to do on arrival, mass medication, processing, we're talking about that now. Here's some of your modified live vaccines. And those are your Martin-Gatton vaccines. One nice thing too about the Martin-Gatton vaccine, they've recently introduced an intranasal. So that's, again, something you'd use on a lightweight, really high-stress calf. And Dr. Lemkuehler mentioned those Florida calves that come up here. Those are prime candidates for intranasals. One thing to think about with intranasal, because I hear this question a lot, when you squirt it up in there, it runs back out. And they'll say, oh gosh, it all dripped out, it didn't do any good. The nasal mucosa is like a sponge. It is absolutely, it's porous, it takes in any fluid that hits it. Doesn't take much. Does not take much of that vaccine to hit the nasal mucosa and stimulate immunity. You're going to see it run out. Expect it. It's like when we use neosynephrine. It's going to run back out, but it doesn't mean it's not doing its job. Boy, the mucosa just absorbs really quickly. Combination vaccine, I talked about, this would be my choice if I was buying 700 pounders. Pyramid 5 plus Presponse or Bovishield Gold one shot. You can usually do all your vaccines in one go-round. In this situation, we were trying to kind of divide it up because we had, to receive them, and then we were going to do the program. So it worked out better for us to do it in two shots. Killed vaccine, again, I would not recommend those in any stocker calf. They're just not going to be useful. And then we talked about the dewormers. Remember, if you use these branded products, they last about a month. If you give these to a calf, they'll go about a month. Long range is the new one that goes 4 months, 120 days of coverage. And these take care of both internal and external parasites. This is what we're using today as the white dewormers. And there's no residual activity. I tried to emphasize that when we were working this last group of calves. We're going to deworm them with this today, and there's no residual. It's going to wipe out the parasites that are internal, and then that's it. It doesn't have a lasting effect. But again, they're not going back out to pasture. So they're not going to be re-exposed. Couple other considerations, pregnant heifers. I'm going to palpate these heifers up here, but we may, if we find one pregnant, we may just leave her just to see the difference in gain. We usually, if we find a pregnant heifer, give Lutalice, which is an injectable prostaglandin, in order to abort the calf. However, it's difficult to palpate any pregnancy under 35 days. So let's say she got bred in the last month, I'm not going to be able to pick it up. Lutalice doesn't work well if the heifer's over about 70 days pregnant. So if I go in there and feel a 3-month fetus, I'm going to have to add something to it besides Lutalice in order to abort that calf. Talking about castration. All right, BVD PI testing is where we are. The ear notch test, at least at our lab, is $3 per sample. And they're all pretty similar, all the labs are. We're using Gold Standard Lab today, and that's a terrific lab. They'll send you boxes, they send you the ear notcher, they send vials, they send it all. So it's really hard to not use them. The death rate due to BVD is well, let's put it this way. BVD PI is in about 3.5 calves per 1,000. So you say, well, that's not very much. Last week on our reportables, we report every Monday to the state vet. He has a list of reportable diseases. One of them is persistently infected BVD. We had 12 last week. And that's just in our lab in Lexington. So that's a pretty significant number. That's the most I've ever seen at one time. Typically, it's maybe 1 or 2. So it is out there, and it is something we need to address. This is BVD. It's a virus. It causes a lot of ulceration around the. This is the hard palate. This is up in the nasal passages. Actually causes ulceration all through the GI tract. But the big effect that BVD has, and this is why it's so important, it's very immunosuppressive. When the virus gets in there in these calves, their immune systems don't work. It actually works down at the level of the bone marrow, where the white cells come from. So they get infected with BVD, and all of a sudden, our vaccines don't work. Our antibiotics don't work. You're saying, why am I putting $100 worth of antibiotic in something and not seeing any result? And usually it's because antibiotics only help the immune system along. They kind of help it get a head start. It's not going to do any good if they've got BVD. So what's a persistently infected calf, and why are we interested in it? This is how they form. This cow is naive. She's probably unvaccinated. She gets exposed, usually through the nasal passage, to the virus, gets in her bloodstream, goes in here to the calf. She's pregnant somewhere between 1 and 4 months of gestation right now. So that virus goes to that calf, and it gets infected right there. It's infected for life. That's called a persistent infection. Never gets rid of it. So why are these important? A persistently infected calf sheds lots of virus. It's a virus factory, basically. So it sheds all kinds of virus through its feces, urine, saliva, nasal secretions. If it gets to be an adult, through milk, semen, uterine secretions. So they're always shedding virus. And what's that mean? That means there's always a source of virus out there. You put a PI calf in a pen of calves, and a pen of 50 calves, it's going to expose all 50 to the virus. There's no way around it. Here's the viral shedding rate. A normal calf that just catches the virus, catches BVD, and then goes through a period of sickness and then gets over it, kind of like we get the flu. So a regular calf that gets BVD infection sheds about 10,000 virus particles per day. And that's represented by one red dot. A PI calf will shed 10 million virus particles every day. That's represented by all these other dots. So it's a lot of virus that goes out into the environment, a lot that goes out in the feed bunk, a lot that touches the next calf, and a lot that goes into the watering trough. So you've got virus everywhere when you get a PI calf, when you accidentally buy one. There's no way to tell. You can't look at them and tell that they're persistently infected. They don't look any different. So we have to find these, and we just came through a case that the vet called me at the lab and said, I got a pen of calves that's been getting sick for about the last, I think they'd been there about 45 days. He said, we continue to have cases of pneumonia, 45 days in. They should be over, within about 2 to 3 weeks, your respiratory problems should be over. 45 days. I said, you test them? And he said, well, we're testing them right now. Did, and ended up with one PI calf in there, got it out, everything settled back down. You know, they're just a constant source of problem. The backgrounders figured this out pretty quickly. So they started testing everything for BVD, and they'd get a positive and then sell it, put it back in the sale barn. Somebody else would buy it, and it became somebody else's problem. So the state vet's office said no more of that. So what the state vet said is, if we get a positive BVD test, if we do, or any lab in Kentucky gets a positive, we have to report it to him. And then he will send somebody out to your farm and want to know where that calf is and what your plan is for it. He's going to educate you and tell you about it, you know, tell you that you can't move it, and then he's going to give you some options. First one's going to be to isolate that calf and retest it in 2 to 3 weeks. I strongly recommend doing that. You know, if you retest it in 2 to 3 weeks and it comes up negative, you're good to go. Doesn't happen too often though. You're allowed to transport a PI calf to slaughter with an OSV permit. That's the Office of the State Veterinarian. So he has to specifically sign it. You can isolate it on your farm and feed it out to slaughter. You can euthanize it and dispose of it. But a test-positive animal is not supposed to be sold, given away, or transported without approval of the state vet. So be aware, if you do test for PI, you do the ear knots, you do get a positive, you know, you're kind of stuck. You're going to have to do something with that calf. Besides sell it. You can't put it back into commerce. They're fine to feed out for slaughter. There's nothing wrong with the meat, not contagious to people. So there's no problem with them there. I think we've got just about everything covered. Let's look really quickly down at calves 10 days to 2 weeks after arrival. That's on the bottom half of your sheet. That's where we are in this program today. They've already had all their receiving. So now at 10 days to 2 weeks after arrival, we're going to booster that modified live respiratory vaccine. We're going to give a blackleg shot. You might know, why would you give blackleg? I think we're going to use blackleg pink eye combination. Why would you do it on the second round rather than on arrival? Anybody know? Clostridials are tough vaccines. They are hard on a calf. They tend to give them a fever. They make them sore, make the neck sore. It's good to defer that to that second shot because it does tend to kind of knock them back on their feed intake. Dehorning, castration, if that's got to be done, I prefer to do it after the calves are already settled on feed. They're a little bit stronger. That is definitely up for debate. Implanting, which we'll do today. Lutalice, we talked about that for pregnant heifers. I think that's pretty well got it covered.